Hi, my name is Sheila Wilson.
Hi,
and
Sheila.
I'm from Stop Healthcare Violence, and today we're up here to see what's going on with the strike.
Yep.
And your name is?
My name's laPensacI.
And I see that you're striking.
Yes, we are.
And it says picketing for our patients.
Yep, in our
and
community.
Our community.
Yep.
Is that the reason why you're striking?
I'm striking, me as Lil, I'm striking for my patients and my community, but I'm also striking for the younger nurses that are going to come after me. I've been a nurse for an awfully long time, and we have younger nurses working that need better working conditions. And that's one of my main reasons for striking.
And so the working conditions involve what?
Well, working conditions involve nurses taking care of too many patients and not having enough ancillary help to help them. About 20 years ago when we first went on strike, we had patient ratios that we put in our contract. But in 20 years, a lot of things have changed. You know, medicine has changed, patients are much sicker. I mean, I'm not even talking about the COVID, you know, the pandemic. In general, patients are much sicker. Patients years ago that used to be in the ICU are now on a regular floor. We don't put them in the ICU anymore. You know, the workload has gotten much, much heavier, and you can't, you know, like I say, you can't do it all. You know, these girls need to have secretaries to answer phones. They need to have nurses' aides to work with them, but they don't have enough hands on deck to help them. Our patients are very sick, and other than the COVID, they were getting sicker. We've filed over 600 unsafe staffing forms, you know, asking the hospital to give us more help, to, you know, supply us with equipment that we need, and it's gone unanswered. And this is the reason this pushed us to do this. Some of the hospital, the administration will say that we're, you know, the M&A, which we are the M&A, us nurses are the M&A.
Right.
You know, it's not a separate entity. We're a part of that. They're saying that they're trying to push an agenda to have a 4-to-1 patient ratio, because, you know, it didn't go through. It was up for, I can't remember what, 2 years ago, I guess it was, and it didn't pass. But the way I feel is the public they weren't knowledgeable enough to know what was going to happen. And the big hospitals, you know, had more money and they had a better campaign, so it wasn't voted in. But it should be voted in. And at least we're trying to do it for our hospital, and hopefully other hospitals will follow that lead, because we're nurses, we're professional people. We want to take care of our patients. That's why we're paying nurses, but you can only do so much.
Right.
You can't do it all.
Well, how long have you worked here?
I have been a nurse since 1979, and I've only worked here. I've never worked anywhere else.
That is awesome.
Yep.
So you're out here walking the pavement.
Yep.
Wearing a sign.
Yep.
Wearing an M&A mask.
Yep.
For your patients.
Yep.
To try to keep them safe.
Yep.
And by keeping them safe, they need the help. More nurses, more ancillary staff.
Absolutely.
I certainly hope your community appreciates that, because
I think they do. I think they do appreciate it. You know, this hospital is a community hospital. Like I said, I've been here so long. I take care of a lot of, I live in the city. I take care of a lot of people that I know, you know, that come here. And I love my job. And actually, some of the things that we're fighting for don't affect me. You know, they don't affect me like they affect the nurses that are working on these floors. You know, I work in same-day surgery. It's a nice little area. You know, it's kind of, I'm at the end of my career.
Yeah, you're on that last train.
I am. And I could easily stay home. I could easily not do this, because I'm not going to get a lot of benefit myself personally, but the nurses out there need help. You know, if I was out on those floors, I would want my fellow nurses fighting for me. You know, so I have to fight for them.
Well, thank you so much, Lillian. That was a great interview. It's great to meet you.
It was nice to meet you. Thank you for coming out.
Oh, you're quite welcome.
We appreciate it. We really do. We appreciate everybody.
As I said, this will be on Boston Making a Difference and Passionate World Talk Radio.
Excellent.
And that will be on all of the, like, not Striker, but Streaker and
Yeah.
YouTube and
Cool.
the whole bunch of them.
Oh, thank you
So,
so much.
Thank you.
You're welcome.
you.
It was my pleasure.
Thank you.
It was nice to
Good
meet
luck.
you.
I
Thank
certainly
you.
hope you do well on this ride.
Yeah, well, you know what? We're tough women. We've been here for a long time, and we're going to keep fighting until we get what's right for our patients.
Awesome.
You know, because, you know, money's okay, but if we're not taking good care of people, then we're not doing our jobs.
Right. Well,
You know?
that's the whole thing. That's why we went into this business.
That's why we're here.